My test is the Tomas test. I will have my brother Thomas demonstrate for us. So, how to perform the test. Step 1, you have the patient lay down supine as so. Step 2, you will make sure that the patient's lumbar region is touching the table, which it is. Step 3, you have the patient grab their knee on the uninvolved side and bring it to their chest. So go ahead, grab this knee, bring it as far to your chest. The hip should go into a posterior tilt as the body goes into hip flexion. If the opposite leg of the involved side is raised off the table or goes into hip flexion at all, it is considered a positive sign. You can use the knee as a measurement tool and then make sure that a positive test indicates tightness of the hip flexors, which are the iliacus, the psoas, the sartorius muscle, and the rectus femoris muscle. If the leg abducts, that is a positive sign for IT band tightness or TFL, tensor fasciae latae tightness. Also positive sign would be lumbar lordosis, and if the back arches up, that is the body compensating for the tightness of the hip flexors. Okay, you can go ahead and putting the body in this position makes the hip go into a posterior tilt, and the table blocks it from anterior tilting, which will put stretch or extension on the hip flexor muscles. Vygotsky, AD 2016, claims in his article that the modified Tomas test is not a valid test unless the pelvic tilt is controlled. The sensitivity of this test is a 31.82% and the specificity of it is 57.14% with pelvic control. With lumbopelvic tilt, it can create false positives or negatives of this test.